thing for me.
So it's art.
Yes.
And there's a science. And what about the safety?
Oh, the safety, yeah, definitely. I mean, all of the proper testing was done when I came here. Blood tests, EKG. We did a thorough review of my medical history, and I was brought into the room. Everything was sterilized. Everybody was clean. I didn't feel like I had any concerns for safety at all.
So there is a risk in hair transplant. Recently, one may have heard about certain deaths in hair transplant industry. Mm-hmm. This is quite possible because it's a surgery after all, and a surgery under prolonged anesthesia. So what should be done exactly is you should stick to the anesthesia dosing, time limits. You should not extend the surgery beyond a certain point of time. Third, we should properly evaluate the patient before the surgery. He should not be a cardiac patient. If he is, there should be a cardiac clearance. If he's a diabetic, his sugar should be under control. Definitely his BP and pulses should be monitored. If there's excessive bleeding or he's on some anticoagulant, that should be stopped or should be modified before the surgery, because all these factors affects the results. And if there's more bleeding, there's chances of more necrosis, more loss of tissue because of excessive bleeding. So I feel safety is the first thing which a patient should select before selecting a doctor.
Absolutely.
Then he should select a doctor. Mm-hmm. Thirdly, he should select a clinic.
Yes.
Then once he has selected a doctor, he should ask for some results which can bring confidence to the patient that he can do my work.
Yes.
Right. Then comes the cost.
Yes.
People in India or globally first look at the cost.
Yes.
Then they select a doctor.
Yes.
So, and fourth, if you're selecting a good doctor, you should ensure that he should be in the OT.
Yes.
He should not be like a big clinic, big setup, but 5 OTs, doctors know it.
Right.
But you are going by a doctor's brand name.
Yes.
So he should be there inside the OT at least and should be considerably involved in major part of the surgery.
Yes.
And
absolutely.
This is missing in not only in Turkey, this is missing in India, this is missing globally as well, because people try to do multiple surgeries in one day, try to double or quadruple their revenue in one day, because they know that patient won't die or something will happen, will correct it.
Yes.
But I think you are paying a price. It's your hair. You have to look. Result comes after 5 to 8 months. So even something goes wrong, we won't realize till the result comes.
I'm a member of a Facebook group that has over 18,000 members on it. Many of them have gone to other clinics in India and Turkey, and you know they're sort of the hair mill clinics where they're doing 7 surgeries in one day, and the doctor is doing almost nothing.
They're looking at a big screen. It's like you're looking at the CCTV footage of the surgery.
Yes, and a lot of these people had really bad results. Not just cosmetically, but just safety-wise as well. Necrosis of the scalp, and I've seen some horror stories from only Facebook, but on Reddit. I mean, you can do your research and you'll see.
So you should not be going to a clinic where a doctor monitors your CCTV footage.
Yeah.
You should be going to a clinic where a doctor actually is inside the OT and doing the work.
Yes, absolutely.
There are 2 things.
Yes.
And that's the difference between a good clinic and a bad clinic. So don't go by a doctor's name, go by doctor's involvement.
Absolutely.
Ask him to promise his involvement.
Yeah.
Request him to be inside the OT and do some work.
Yes. I see a lot of people mentioning the names of the clinics, like that's the most important thing, but it's not. It's the surgeon that's going to be performing the procedure.
Definitely. And a doctor won't. And so that is a very important part. Safety. And even the International Society of Hair Restoration Surgery, which I am a member of, specifically mentions black marketing in hair transplant.
Yes.
And specifically mentions hair mill clinics.
Yep.
Mentions clinics which promises unlimited grafts, scar-free surgery. I think there's no scar-free surgery. Scars will be there if there's a cut.
Yes.
There cannot be unlimited grafts.
Right.
There cannot be a surgery in which you can do more than 3,000 grafts in a day. Mm-hmm. So you can't put 4,000 grafts in a day.
Yes.
It's not technically, it is possible, but your body will be stretched.
My brother who came with me to Turkey, we didn't know any better, but at the time he was only 23 years old. Mm-hmm. And I don't think his hair loss had fully progressed yet. Mm-hmm. But they wanted the money, so they did his surgery anyway.
Very important point. So you should not be doing on a patient whose baldness has not stabilized.
Right.
Or you should be doing a very conservative surgery, not lowering his hairline, not creating the temples.
Yep.
Not lowering the hairline. Because if you're going to progress to grade 6 or grade 7 baldness and you're just creating a hairline and everything vanishes.
Yeah, my brother was only 22 or 23 and they did it on him, and he had a very thin donor area to begin with. And now he has almost no donor area left, so I don't even know if he would be able to get a correction.
So that's a disaster. That's a hair transplant disaster. So you are very happy 2 years after the surgery, maybe a year after the surgery, but you start getting depressed once you realize that there's just a rim remaining and everything's going
Yeah,
on.
and that's what he has, unfortunately. So he's kind of just shaving his head now.